Okay, welcome to day 4 of the 2021 Planetary Health Annual Meeting, co-hosted by the University of São Paulo and the Planetary Health Alliance. I am Andrea Lund from the University of São Paulo. I'm very pleased to be introducing the Science Lightning Talks on Infectious Disease. 5 abstracts were selected and will be presented as pre-recorded videos, and subsequently, the authors will participate in a live Q&A session. I would like now to introduce our moderator, Dr. Felicia Kissing from the Bard College in Annandale, New York, who will lead us through the conversation. The floor is yours, Dr. Felicia.
Thank you, Andre, and welcome everyone. It's wonderful to see so many people joining us from so many places, I understand. I'm particularly happy to welcome our wonderful speakers who have promised us these incredible talks through their abstracts. As Andre said, the format will be that there will be pre-recorded talks. Each talk is, as I understand it, 3 minutes, so these are definitely lightning experiences, and then you'll be able to enter your questions in the Q&A, and we'll have a healthy time for back and forth after that. And so without further ado, I ask for the talks to begin, and I look forward to talking with you about them afterwards.
I'm excited to talk about my research on how exposure, hazard, and vulnerability all contribute to schistosomiasis risk in northern Senegal. At its core, risk is the probability of an event occurring. Today, the event of concern is infection with schistosome parasites, which affect 200 million people globally and can cause organ damage, cancer, and infertility. With this aerial photo of a water access site in a village in northern Senegal, we can visualize different components of schistosomiasis risk. The parasites are transmitted by aquatic snails, which release larvae into the water, and those larvae can infect people by burrowing into their skin. So activities like bathing or washing livestock may put people in contact with parasites. We call this exposure. By itself, water contact isn't harmful. It's water contact in the presence of snails shedding parasites into the water that matters. We can think of snails or the submerged vegetation where they live as the hazard that makes exposure harmful. The third component of risk is vulnerability, or whether or not people can still meet their needs if they reduce their exposure to the hazard. We aimed to understand the relative importance of each component of risk on both the presence of schistosome infection, or whether or not a person became infected, as well as the intensity of infection, or how many parasites they have in their system. And we did this among school-aged children in northern Senegal. And we used ecological and household survey data to construct different indices of exposure, hazard, and vulnerability, which we then used to fit statistical models to infection data. We used a technique called multi-model inference to assign weights to each model and calculate which components of risk were included in the best fitting models. This process generated values of relative importance, which ranged from 0 to 1. For infection presence, hazard was the most important component of risk, with vulnerability a close second. And exposure was in all of the best fitting models of infection intensity, and so it was the most important component of this outcome. Results indicate that the risk of schistosome infection is a product of both environmental and social processes, where snail ecology intersects with human activity. We also found that the relative importance of exposure, hazard, and vulnerability differed by outcome, with hazard an important determinant of whether a person got infected, and exposure driving how heavily infected a person became. These results can inform what social and environmental interventions will be the most useful complements to mass drug administration programs in endemic areas. Thank you.
Hello, my name is Isabel Fletcher and I'm a PhD candidate at the London School of Hygiene and Tropical Medicine. And in this study, we wanted to explore the impact of environmental degradation on malaria re-emergence. And we did this in Venezuela, which is a country that has experienced a rapid surge in cases over the last 20 years. And this is really worrying as it's threatening the progress of other neighbouring countries in the Latin American region towards their malaria elimination. And so we combined multiple sources of Earth observations, which included climate data, land use data, and data on mining activity in a Bayesian spatiotemporal modelling framework that allowed us to account for unobserved factors such as bednet usage. And we focused on a malaria hotspot in the south of the country, which is called Bolivar State, which is shown on the map here. And it's hypothesized that the increase in cases is due to unregulated gold mining activity that creates more suitable habitat for mosquito vectors, such as Anopheles darlingi, and it's this that we think is sustaining malaria transmission. So we modelled malaria incidence in this region, and looking at the environmental drivers, we found that increased malaria was associated with mining activity, reduced rainfall, and El Niño conditions, which bring warm and dry climate to the region. And we also found that deforestation was associated with increased Plasmodium vivax malaria. In this study, we also wanted to provide evidence that mining activity is really important for driving patterns of malaria incidence. And we showed this using our model, that it's really important in hotspot areas, and because when we account for mining activity, this can explain the unexplained spatial variation in malaria. And we see this through a reduction in the value of the random effects of our models, which are highlighted in the circles. And in these hotspot areas, we found that mining could explain up to 84% of unexplained malaria variation. Finally, we also wanted to explore how land use may modulate the effect of climate on malaria transmission, because the interacting effects of climate and land use change are often not considered together. And we found that the nonlinear impact of temperature on malaria transmission was much greater in areas that were more deforested compared to areas with minimal amounts of deforestation. And this is because deforestation creates favourable microclimates for Anopheles darlingi, which is the primary malaria vector in the region. And with that, I'd like to thank you for listening, and thank you to all of my collaborators and LabRoot for the support for this work.
My name is Rosa von Borries, and I'm going to present a systematic review on the influence of weather conditions on COVID-19 transmission dynamics. Since the beginning of the pandemic, there was high scientific interest in understanding potential seasonal patterns of COVID-19. This figure shows that other respiratory viruses commonly show seasonal variations. For example, influenza and other human coronaviruses tend to peak in winter, but the underlying mechanisms are not fully understood. Potential key mechanisms include direct effects of weather conditions on virus survival. For example, simulated sunlight was found to inactivate SARS-CoV-2 under laboratory conditions. A second mechanism is via the human immune system. The body's ability to clear virus-containing particles may be impaired under cold and dry conditions. A third indirect mechanism is based on human behavior. Individuals might spend more time indoors when it is hot, cold, or raining, which transfers transmission dynamics to indoor spaces. Two researchers conducted the systematic searches and selection of studies, as shown in this flow diagram. We included peer-reviewed studies that investigated the influence of meteorological factors on COVID-19 transmission dynamics. Statistical modeling studies published until 18th November 2020 were considered. In terms of preliminary findings, we illustrated the spatial distribution of selected studies. Most studies were conducted in China, the US, and Italy, colored in darker green on the map. 24 studies were categorized as global studies, which were not illustrated. It is critical that modeling studies account for relevant non-meteorological factors. This bar chart illustrates the different non-meteorological factors considered in studies. Age structure, population density, and socio-economic factors were the factors most accounted for. Several studies did not account for any modulating factor, which potentially leads to inaccurate findings. Studies with varying quality have shown inconsistent results of weather impacts on COVID-19 transmission. Future robust studies of meteorological sensitivities are needed. This graphic includes recommendations for good research practice, such as clearly communicating uncertainties and limitations. It is part of the first report of the WMO COVID-19 task team on meteorological factors in air quality affecting COVID-19 transmission dynamics. It is critical to ensure high standards of research practice, given that COVID-19 study findings might be used to support decision-making and response efforts. Thanks for your interest in this topic.
Hi, thank you for joining my lightning talk today. My name is Ryan Harp, and I'm a postdoctoral research fellow at the Institute for Sustainability and Energy at Northwestern University in Evanston, Illinois, in the United States. And today I'll be talking about using climate to increase the lead time of a malaria early warning system in Mozambique. So Mozambique reports about 8 to 10 million cases of malaria each year. And because of this, they developed an early warning system which uses observed case counts and observed weather conditions to try to forecast future outbreaks of malaria. The goal of this project was to increase our understanding of how climate variability affects malaria in order to increase the early warning lead time. So the data that we're using, we had weekly malaria data for 148 districts in Mozambique, which you can see on the right here, spanning from 2010 to 2017. We compared this with climate data, which included precipitation, sea surface temperatures, other things like wind and temperature. And ultimately, the crux of this analysis, after doing some quality control on our data and pre-processing, was an empirical orthogonal function analysis, or EOF, which identifies patterns of shared variability. And what this looks like, you can see on these results here, where we have our two dominant patterns of year-to-year variability of malaria. On the left here is our dominant pattern. And anytime you have dots here, each dot represents a district. If there are two dots that are the same color, particularly if they are very intensely the same color, their rates of malaria tend to vary together over time. And so you can see this pretty strong cluster over the central and southern part of the country. And this pattern explains about 64% of our year-to-year change in malaria. On the right, you can see the secondary pattern, which explained about 17% and was focused primarily on the northern part of the country right there. Ran similar analysis on precipitation, which you can see right here. Very similar clustering. I'm not going to go into it too much right now, but ultimately we tied that first pattern of year-to-year malaria variability, which you can again see on the right here, to the El Nino Southern Oscillation. So we see during a La Nina, compared to an El Nino or neutral phase, we see much more precipitation over that central and southern part of Mozambique, which mirrors very nicely what we saw in the malaria EOF. We also tied our second pattern to a more regional mode of climate variability called the subtropical Indian Ocean dipole. Ultimately, we think that this information on quasi-predictable climate phenomenon could help enhance early warning systems by increasing actionable lead time. If you're interested in more, feel free to check out our publication, which came out early this year. You can use this QR code right there to scan to it. Thank you very much.
Hello, I'm Sophie Lee, and I'm going to talk about the expansion of the dengue virus transmission zone in 21st century Brazil. Dengue fever is an arbovirus transmitted by mosquitoes of the Aedes genus. It's hyperendemic to Brazil, and the past 20 years has seen an explosive increase in incidence rates across all regions of the country. Previous studies had identified geographical barriers to dengue diffusion, beyond which regions were considered relatively protected from outbreaks. These included the Western Amazon, which is a remote area of the country, and the south of Brazil, where seasonal temperatures were too cold for vectors to efficiently transmit the virus. These maps show the year of first outbreak as defined by the Brazilian Ministry of Health as over 300 cases per 100,000 inhabitants. We use this binary outbreak indicator within a Bayesian spatio-temporal model to better understand and quantify the expansion of the dengue virus transmission zone and identify potential drivers of this. We hypothesized that the southern border was related to climate suitability. Here we've shown the average number of months which were suitable for dengue virus transmission. Notice that the majority of Brazil is suitable for year-round transmission. However, the south of Brazil experiences very cold winters where Aedes mosquitoes are unable to transmit the virus. We also hypothesized that the Western Amazon barrier was a result of its lack of connectivity. Here we've extracted the level of influence of cities from the urban network in Brazil. Cities were categorized based on the level of opportunities and the movement between them into 5 categories. The top level was a metropolis, which is the largest cities in Brazil, which are connected throughout the entire country as well as internationally. And the lowest level was a local center, which were only connected to themselves. We can see there's a stark difference between the Western Amazon, which is mostly disconnected from the urban network in comparison to the rest of the country, in particular the southeast of Brazil. We included these indicators as well as some others into our spatio-temporal model, and using simulations from the posterior distribution, estimated the probability of an outbreak. Here we've aggregated this to each decade by taking the average probability to show the changes in the risk patterns. We can clearly see the expansion in the dengue risk zone. It's especially clear in the south of the country, where we can see this geographical barrier moving into the region. We found an increased odds of outbreaks in highly urbanized settings, which had experienced outbreaks previously and had suitable temperatures for the Aedes mosquitoes to transmit. All regions which had a higher influence level than local centres had an increased odds of outbreaks. We intend to expand this model and improve it using monthly case data to explore the impact of more fine-scale climate changes and include factors related to any changes in connectivity over the period. Thank you for listening.
Wonderful. I think that concludes our talks. And I'd like to suggest that anyone with questions, please submit them through the Q&A function at the bottom. You can't submit through the chat, but you can submit through the Q&A, and I'm sure there are questions for our wonderful panelists. Before we dive into the questions though, since that's all pre-recorded, I tried to show a little enthusiasm for these talks as they went, but I would love to have all of us just thank our speakers, those of us who can, thank the others on video, and everyone else. Let's just take a moment of appreciation for the time they put into recording those talks in advance and making them so incredibly crystal clear and so condensed so that we could get such a wonderful idea about their research so quickly. I see we have a question from Ryan, and I think that's a question for our last speaker. Is that right, Ryan? Is this the, what, oh, this is a question for Ryan. I'm sorry, I'm misreading this. The question is for Ryan, what would be the predictions for malaria outbreaks if you consider climate change?
Thanks for the question. I think that's a little bit tricky to tell and kind of beyond the scope of what we were looking at. I think in general, climate change is certainly going to be leading to differences in precipitation patterns and things like that. But what that might mean for malaria transmission is going to be pretty local. I mean, there's some places where increased precipitation leads to increased rates of malaria, other places where too much precipitation could wash out mosquito breeding grounds. And so I think it's pretty variable, and yeah, not something that I can fortunately give a great, nice condensed answer to. But I know there's a lot of work being done on it.
Do you think that there is enough, this is just a follow-up on that question, do you think there's enough data on how climate might have changed over the past 20 years or so that you could start to incorporate that into your models, or are those data too hard to gather?
I think the data certainly exists. I'm not sure if we've seen enough of a shift just over the last 20 years or so where we could really see a clear signal and change in malaria transmission, but it's something that people are looking into, not something that I've taken too close of a look at. So I don't know offhand, but I know it's something that will be receiving a lot of attention as we move forward.
Yeah, absolutely. I would say we have a lot of people who are thinking about climate and various measures of risk. So if any of the other speakers want to jump in here and talk about what they've seen in their data sets, that they are welcome to do so here for climate or any other topic. You can interrupt me, and I'm going to give you a moment to do so. All right, we have another question, and I think this is for our COVID talk. In terms of the impact of weather on COVID transmission, would you expect the effect to be more strongly tied to the weather variable, for example, the relative humidity that you mentioned, or more strongly tied to the effect of weather on human behavior, for example, time spent indoors, mobility, or how much people are interacting?
Thanks for that question. That's a really good question. So as mentioned in the talk, there are these three main mechanisms. So one is the kind of the direct mechanism, which affects the virus survival. And this can be measured most effectively in laboratory studies. And for COVID-19, there exist a couple of laboratory studies, but there need to be more. So there are some studies show that lower temperature and low humidity basically kind of lead to higher transmission or higher survival basically of the virus. And then there are the epidemiological studies, so the ecological studies, and these can basically also measure human behavior. And there exist studies that basically showed that government intervention had a really strong effect. So, and government intervention do also then have an impact on human behavior. So for example, wearing masks includes that, not being able to travel. There are kind of, there are findings that show that human behavior is quite a strong factor, but we can't really say which one is the strongest one. So there are these three mechanisms, but it's quite difficult to say which one is the most important one. But human behavior plays an important role. That's quite clear.
So I want to follow up on that question in your answer. Just I was curious that you did this wonderful job of looking at what people have found, looking at all of these studies in a sort of meta-analytic framework. And I wondered if you started now knowing what we know about how COVID is transmitted and how various interventions have affected transmission in different countries. Could you do a study now that incorporated all of those things and looked at country to country variation and teased it apart better than studies were able to do in the early days of the pandemic?
Yeah, so one very important point is that you need quite a kind of long time period to be able, or that it's actually that it's easier to get accurate findings if you have a quite long time period. And most of the studies from last year, they were conducted, or they considered data from basically the beginning of the pandemic until the summer 2020. So that was basically the first wave, you could say, that was included. So if you would do a study now, you could consider much more data, which would be, which could lead to better results as well. And an important point as well is how countries conducted COVID-19 testing. So in the beginning, it's quite likely, in the beginning of the pandemic, it's quite likely that COVID-19 testing was not very accurate and that a lot of COVID cases were missed as well. So there were quite a lot of asymptomatic cases, which is still the case as well. And since we are now already, since we are in this pandemic already for more than a year, we also kind of made advances in testing and having kind of different ways of doing these, of doing tests, which leads to better data.
Mm-hmm. Mm-hmm. It seems like a really promising question to ask now with better data and longer time frame. So thanks for that answer. One of the things that really emerges from all of these talks is that there are patterns that all of you have detected that have implications for policy, and you've all sort of pointed to how the data that you've got or the patterns that you've detected might be useful. And so I want to probe around on that a little bit. I think all of you should maybe take that another step further in thinking aloud without having to maybe claim it as an official result of your study. But I wanted to start with Andrea, because you did such a nice job of separating out risk and hazard, hazard, exposure, and vulnerability as components of risk. So we got the sense from the data that the hazard and exposure were key factors from your models. I'm curious whether you have a qualitative sense of which of those are most addressable. So if you were going to say which ones have the biggest impact of the way things are now, which is basically what your models did, but you tried to combine that with what kinds of interventions we know to be most feasible, most economic, most effective, where would you head? Would you head towards hazard, exposure, vulnerability, or would you try to do a little bit of all three?
Yeah, thanks for that question, Dr. Keesing. That's a key one and an interesting one. I'll note that most of the time in the case of schistosomiasis, treatment is sort of the main intervention used to control the disease. And I think that this work really demonstrates that it's a multifaceted problem that requires sort of multifaceted solutions. So in seeing hazard emerge as an important component of both presence and intensity of infection, I think that makes a case for really working on addressing the environmental source of infection and seeing what we can do to limit snails in the environment and minimize the amount of contact that people have when they're carrying out their livelihoods. The question of behavior change is a really difficult one in settings like this because people are really tied to their water sources for domestic reasons, collecting water, bathing, even their livelihoods of doing agriculture and being in contact with water that way. And so I think that the sort of working on limiting snail populations, but then also water and sanitation are kind of two other areas. That's sort of the reducing the vulnerability piece that I think can have follow-on effects on the hazard, as like this is a very connected system where the amount of human urine and feces that's going into the water has bearing on how many parasites are circulating through the system. So I think that it needs to be, the short answer is that it needs to be multiple things, but the sort of joint environmental social pieces seem most important to me, at least.
I think that raises, Isabel, I'm coming for you next, but I think that raises a really interesting question that comes up a lot when we think about the environment versus treatment, for example, and that is whether the money available, the resources available to do one compete with the resources available to do the other, or are they different pools of money, for example, or different personnel, or different kinds of attention from communities that could lead to there being synergistic as opposed to competitive responses where you have to pick between one or the other. And I think that's an important one. Isabel, I was curious in your analysis whether I'm interested in that policy piece, and I suspect a lot of people are. What do you do about this impact of mining, for example, on all of this? But I also wondered if you were able to account for or have a sense of how the impact of mining might affect the number of people in those places. Is it causing a huge increase in human population that could be driving some of the case numbers, or are those corrected? I couldn't quite tell if they were corrected for incidence in your analyses. And then again, that policy piece, knowing what you know, what would you do? What would you recommend?
Yeah, thanks. And that's a really interesting question. And I'm glad you brought up the stuff about population movements, because that was one of the major limitations of our study, because this area is quite disconnected in Venezuela, and we know that mining sites, they have a continual influx of people that are moving there to work, but then they're also moving out and then moving back to the cities, and that's how that's sustaining transmission of malaria in the region. We do highlight that is a real issue. We couldn't really account for these population movements, and we actually found that in the mining hotspots there were more cases recorded than actual people, which indicates to us, yeah, there is a bit of bias there, and there isn't really, we couldn't really find a way of accounting for it. But I think someone mentioned something about accounting for spatial bias and things like that. What we could do with our modelling framework is, through using our spatiotemporal random effects, we could try and account for that extra variation, because we know it's going on. And so if we utilise our model to account for what we think is going on with mining and that environmental degradation, and then we can see, okay, what variation is not being accounted for, and that was what we would consider the population movements. And then your other questions about policy, that's quite a difficult one, because it's difficult in a region like this where we're seeing such a rapid re-emergence, and a lot of this mining activity is unregulated. Most of it is illegal, and it's really difficult to quantify where exactly it's happening, if mining sites are continually popping up, and as I said before, how many people are actually going there. But what we did find that was important is that you can't consider the impact of climate to be the same throughout space. So we found that land use is actually really important, and there's this synergistic effect with climate and land use change. So that obviously has implications for malaria treatments, such as prophylaxis, but then also distribution of bed nets. Do we need to prioritise distribution of bed nets to these mining sites over areas that are almost a bit protected because they're not as connected, people aren't going there? And that's what we were able to do.
Thank you. That's a wonderful answer. Sophie, I'm going to ask you a question that came in from the audience, but I also want to invite you to respond to the policy question. A person listening in asked, other than climate change, what are the drivers for increased vector-borne diseases? And how could improved infrastructure and stewardship of biodiversity prevent exposure, hazard, and vulnerability? So you could think about that in the context of your system, and or think about what kinds of policy changes you might suggest in Brazil in response to the patterns that you found in the South.
Yeah, so one of the things that we'd like to expand on in the model that I've just carried out is to account for kind of differences in urbanization, because we know rapid urbanization has a massive impact on dengue fever, but also when you've got this rapid urbanization of places and the services such as water supply and sanitation services, when they don't catch up to it, people then store water containers, which can become breeding grounds for dengue, for the vectors. So we know that that is an issue. And also in places where they do have piped water, there's some places in Brazil which are affected by extreme droughts, for instance. So even if they have that access, it doesn't mean it's there all the time, and people do have these kind of behaviours that then happen because of that. So I'm hoping that it's hard to quantify in such a big region, because all the states and have different ways of recording things. So it's quite hard to pick that apart within a model, because they're not always they're very biased generally. But yeah, water infrastructure is definitely a huge driver of dengue fever. Yeah.
Thanks, Sophie. It's really interesting. I'd love to hear more about that. I've been reminded that even though this seemed like such a wonderfully expansive Q&A time, we've come into the last 7 minutes. So I'm going to address another question from the audience to all of you, but I'm going to ask Rosa and Ryan to tackle it perhaps first. And that is the question really of data quality. So Rosa, you addressed this very directly in your response to my earlier question. The question from one of our attendees is, how do you think the lack of continuous sampling and spatial bias can create uncertainty in models, and what's the best way to portray that uncertainty? You know, so we all tend to take the data that we have and tell the best story we can with those data, and you've done a wonderful job of pointing out questions in your research, but how do you think it can affect your conclusions in a substantive way? Ryan, do you want to start with that for us? And then Rosa, will go to you and the other three.
Sure, I think that's a great question. And of course, any of the work that we do is going to be very limited by any of the inherent issues that we have with underlying data. And that's something to keep in mind with any of the statistical methods that we might all be using. I know in our case, we had data from 2010 to 2017, which like I'm a climate scientist. From what I understand from my public health collaborators, that's a very great lengthy data set, particularly given that we had data for over 140 districts. And so from their perspective, it is this wonderful data set that we had the opportunity to work with. But from a climate side, some of the things that we were looking at comparing it to are things that only happen, like in the case of El Nino and La Nina, things that recur every 2 to 7 years. And so we had to come up with some kind of underlying indices that we could use to try to kind of extrapolate out from the 8 years of data that we had to look at these climate phenomenon and expand out kind of our time period of analysis back to the kind of beginning of what we call the satellite era, when we have great satellite data going back to late 1970s and early 1980s. So yeah, it's certainly a tricky thing and something that we all need to consider as we're going about our work.
Right, and you raised the important issue that what seems long to one discipline doesn't necessarily, or phenomenon doesn't necessarily seem long to them all. Rosa, do you want to respond to that and also maybe think about the policy question for COVID and weather going forward?
Yes, thank you. So for COVID-19 studies, the spatial level plays quite an important role. So for example, if you take data at a country level for bigger countries, for example, and COVID-19 cases might be quite might occur quite in a quite different way within that country. So it might be quite heterogeneous within the country. That might lead to inaccurate results. So it is quite important to kind of try to use data at a fine spatial scale. And then what is also important is to kind of match it with the weather data at the same spatial level. So to kind of match that. And regarding the policy questions, so for COVID-19 so far, we don't have strong evidence that weather plays an important role. So governments should so far not use weather data to kind of adjust mitigation measures, but it might be more important in the future. And a very interesting point could be that weather data could be used for vaccine strategies, for example, so vaccine distribution and vaccine kind of coverage in the future. So that is something that might be more important when COVID-19 gets endemic and when the susceptibility might actually decrease. So that was also something that we saw kind of last year, that the susceptibility of the population was so high that it was really difficult to detect the effects of weather. And at a later point, that might change.
Thank you. That's really interesting. I'd love to talk more about COVID, but we have now 2 minutes. Andrea, would you like to say something about data quality? You had a somewhat different take on data where you were collecting some of those data yourselves, right?
Right, yeah, so I was in the field in Senegal doing some of the household surveys, and within that, that's sort of how we measure. We tried to measure exposure in multiple ways, or in as many ways as we could. We're using a questionnaire in one way to understand frequency of exposure, of how often people are coming into contact with water when they're doing different activities. But this is just a snapshot of a process that's very variable in space and time. And the same can be said for measuring the snail populations as well, which I wasn't directly involved in, but my colleagues were. And yeah, just the understanding when people are overlapping in space and time with the hazard, if you will. Like that's what we care about, but we don't always have the ability to capture that precisely. So we have to do the best we can with the tools available to us. Dr. Keesing, you're muted.
Thank you. I think we have less than a minute left. I want to give the panelists a moment if anyone has one final thought they'd like to share. What an ask. I should have warned you that was coming. I have been asked by the organizers to remember that you were invited to continue the conversation by joining the Planetary Health Alliance, and there is a link in the chat for how you can join PHA. I'm sure also that our speakers would be happy to have you contact them directly by their email addresses, which are available in the conference materials. They all have thought so deeply about their data and put so much time into those wonderful lightning talks. Let's thank them all again. I know it's a little hard to do by Zoom, especially when you can't chat, but thank you all for being so thoughtful in your presentations. And with that, I would like to close this session with a final thank you to the organizers who made this as seamless technologically as one could possibly imagine. I only wish I were in Rio with you all to, we'll have to have a reunion when we can and all meet in Rio someday. Thank you all. With that, I'll close the session.